Hello, I'm Professor David Matthews. I'm Emeritus Professor of Diabetes Medicine from the University of Oxford, and I'm currently the EASD President. So the interesting thing about the SGLT2 inhibitors is that one of the signals that we didn't really properly recognize early on was that heart failure was a specific problem with people with diabetes. So we were measuring myocardial infarction and stroke and so on in the old-fashioned way of MACE, major adverse cardiovascular events. And no one had really thought about heart failure. And it was only with the advent of some of the SGLT2 trials that people realized, oh goodness, that heart failure really was a proper side effect of diabetes, and one that could be really improved in terms of its outcome by the use of SGLT2 inhibitors. Well, then the question arises, well, does this work in other people who don't necessarily have diabetes? I mean, could we use SGLT2 inhibitors in people who have got incipient heart failure? Because after all, the chances of the reason behind the SGLT2 inhibitors improving your outcome for heart failure is that they have a diuretic function, that you're losing glucose, that you're losing sodium, and maybe some of that is worthwhile in terms of treatment of heart failure. Well, the DAPA-HF trial then looks at that particular question and comes out with a brilliant positive result saying, actually, these agents may well start being used not just in people with diabetes, but people with incipient heart failure.